in one sense, only certainly much more marked, very much more so. Yeah, and similar again, actually. We're also seeing some rotation in this direction. So we're seeing this kind of a torque, and we're seeing this kind of a torque. We are we have a higher shoulder here on the right side, which is not what I would have expected actually. I would have expected more on this side. Equally, what we have, if you can see, that shoulder is very tight, compressed, like so, relative to that one on that left side. Okay. So there are other things, as I say, that we can look at, but I want to move on. Have you any particular issues, Dan, that you would be symptoms, in other words?
You want me to start at the beginning?
Currently, I've got a right groin pull.
You've got
a right groin pull.
Right groin.
I play a lot of soccer, so
okay.
that was an instantaneous thing. But I would say through most of my issues, I'm a blood clotter. I had a pretty extensive blood clot in my thigh, so it causes my left calf to stay relatively thick. I had a pulmonary embolism in my left lung. So, but it doesn't stop me from playing soccer, you know.
Right, okay.
Which is why I probably get injured as much as I do.
So symptom-wise, you'd be aware of both sides, really, and you were saying in the left leg, is it you got?
Left leg.
Left leg.
Mm-hmm.
And then you have a right groin?
Right groin.
Okay. And are you, as we speak, are you conscious of those?
Yes.
Okay, good. Good. All right.
Well,
We know what you mean.
Yeah. Okay, would you guys like to do just a couple of checks? Huh?
So I see his upper torso being a little bit torqued this way, this arm being a little bit forward. This perspective. A right high pelvis, low on the left. Anterior head carriage. And let me have you take a step forward with your right foot. Hold this arm up. Okay, really strong. 1, 2, 3. Okay, and switch this foot forward. 1, 2, 3. Oh, that's nothing. Do you feel the difference there?
Mm-hmm.
Wow. Let's try it. You'd be very interesting. Let's try you having march in place with your eyes closed. Really high steps. Okay, that's good. Now look where you ended up. You can go ahead and open your eyes. Okay.
I feel it.
Yeah. Okay. And we're also going to try the push test. Okay, I'm going to try to push you over. Don't let me do that. Ready? 1, 2, 3. Okay. Side. 1, 2, 3. That was easy.
Oh, he's well off.
So pushing him from right to left, it was very easy. Okay. Okay. Just have to go ahead and lay on the table.
Yeah.
So in this position, his left leg flares out to the side. And very short right leg.
Very short right. Okay. So, okay. All righty.
His obvious foot flare changed. That balanced out nicely.
Oh, okay. Oh, yes, indeed, yes. Mm-hmm.
It's nice and even. Leg length's balanced out as well.
Yeah, you remember that that foot was like this before, and the changes there. The change has gone through there. Was there leg length? Okay.
Leg length's
Leg
perfect.
length changed. Okay.
Okay, come on up. Just coming a little bit further this way. There we go. Okay. Good. Looks nice and straight ahead.
Certainly seeing some change. It's not all even, but it certainly I'm seeing a change there. Yeah. And so I'm also seeing a change there as well. Okay.
Shoulder heights look good. That upper torso torque that he had looks nice and even now. It's not so much this way.
Yes, right, okay.
Pelvis height's even.
You just want to have a stroll up and down just a time or two there, and okay. Now, in terms of your symptoms, are you aware of any change?
It's just a slight bit, but compared to what I was feeling when I was walking up onto the stage, that's pretty amazing. And you talk about the spiraling that you could feel. I noticed that Juanine mentioned that felt like it was letting down, or and you can feel that. Definitely, you can feel that. So
yeah.
And I could, when I was lying there and you were doing the leg flare, even without looking at it, I could just feel my left leg falling over. And if it was straight when it was all done, then there you go.
Are you aware of any change in that side there at all?
It's hard to say. I have a compression sock on right now.
Oh, okay.
I usually notice it when I have the compression sock off as far as some of the thickness and the fullness
Okay.
of it. But I felt like I was walking okay. I'll play soccer tomorrow, so we'll find out. I'll have Tom Ledge,
Okay, yeah,
give a
sure,
message
sure.
from him. So.
Okay, good. Well, again, thanks for your participation. So thanks to our two participants. And I think the message I really wanted to get across was in many ways, the oneness of illness or disease or disorder. And although we have a million names out there in the medical dictionaries for all sorts of illnesses and so on, there is at the core of it all a oneness. And that oneness is really what we are doing now. The oneness, the problem behind the problem, as it were, the one that is unrecognized, the one that is untouched, not known about out there, and yet to me is the number one, is the primary issue. So thank you, and I'll hand you over to Tom.